cervical cancer remains a significant health concern for women worldwide. Though it's a potentially life-threatening disease, it's also highly preventable and treatable, especially when caught early. Today, we'll explore the causes, symptoms, risk factors, and most importantly, how prevention and early detection can save lives. Cervical cancer begins in the cervix, the narrow passage connecting the uterus to the vagina. The primary cause of cervical cancer is the human papillomavirus, or HPV. This common virus is transmitted through sexual contact, and certain high-risk strains of HPV are directly linked to cervical cancer. While HPV is the main cause, several risk factors can increase the chances of developing cervical cancer. These include smoking, which weakens the body's ability to fight infections, and having a weakened immune system due to conditions like HIV/AIDS. Other factors include early sexual activity and having multiple sexual partners, which can elevate the risk of HPV infection. Even a family history of cervical cancer can slightly increase your risk. Often, cervical cancer doesn't show symptoms in its early stages. However, as it progresses, signs can include abnormal vaginal bleeding between periods, after sex, or postmenopause. You may also experience pelvic pain, unusual vaginal discharge, or discomfort during urination. The good news is, there are several effective ways to prevent cervical cancer. The HPV vaccine is highly protective, especially when given before exposure to the virus. Regular Pap tests are essential. They can detect abnormal cell changes in the cervix before they turn into cancer. HPV testing, often done alongside a Pap test, helps identify high-risk strains of the virus. Additionally, safe sexual practices, including condom use, can reduce the risk of HPV transmission. Quitting smoking also significantly lowers the risk of developing cervical cancer. Despite the benefits of HPV vaccination, many myths persist. One common myth is that cervical cancer is rare, so vaccination isn't necessary. The fact is, cervical cancer is still a global health issue, and vaccination is a crucial step in reducing its incidence. Another misconception is that the HPV vaccine is only for young girls. In truth, the vaccine is recommended for both males and females, as HPV can also cause other cancers. It's most effective when given during adolescence, but it's never too late to get vaccinated. There's also no evidence that the HPV vaccine affects fertility. It's designed to prevent HPV infections and their consequences, not impact reproductive health. Another myth is that if you've had the HPV vaccine, you no longer need Pap smears. In reality, while the vaccine protects against many cancer-causing strains of HPV, regular screening is still important. If cervical cancer is detected, treatment depends on how advanced the disease is. Surgery, radiation therapy, and chemotherapy are common treatments. The earlier the cancer is detected, the better the chances for successful treatment. Cervical cancer is preventable and treatable, and the key is awareness. Regular screenings, safe practices, and the HPV vaccine are your first lines of defense. By understanding the risk factors and recognizing potential symptoms early, you can protect yourself and take control of your health. Remember, cervical cancer prevention is about more than just awareness, it's about action. Get screened, get vaccinated, and talk openly with your healthcare provider. Together, through knowledge and proactive care, we can reduce the impact of cervical cancer on women's lives. Empower yourself with the tools you need to stay healthy.